investigator for the WHO for a variety of projects, and has been a trainer of trainers, and has been chairperson of the pediatric cardiology chapter for 5 years, starting 2017, ending 2017. And among other things, she has been a mentor and a wonderful person. And over to you, ma'am, for the webinar. Dr. Rani Gera.
Yes. Good afternoon, Hemant.
She will be joined by Dr. Sumit. Yeah, she will be joined by Dr. Sumit, who is the nodal officer for vaccine preventable diseases at Safdarjung Hospital. Both of them will be guiding us through the child health and immunization services during COVID-19 pandemic for children. Over to you, ma'am.
Good afternoon, Dr. Hemant, and thank you so much for getting me on board. It's my immense pleasure that I can talk to so many beneficiaries, CGHS beneficiaries, day in and day out, the questions that we have to address. So a very good afternoon to the entire patronage of gentry who has joined us for this webinar. So today we'll be speaking on child health and immunization services. So these are interrelated because this is about the immunization services during COVID-19 pandemic. I will be giving you a little brief on the considerations of the COVID-19 pandemic, that what is it caused, and how it has affected our immunization services, and how it has affected the child health. So coronavirus prevention is, as you all have repeatedly been hearing, it is to wear a mask, wash hands, and avoid crowded places, and go to the doctors as soon as possible whenever there is some element of suspicion. Next. The document which has been prepared is based on the currently available guidelines, literature, and information from WHO, UNICEF, USAID, CDC, and Ministry of Health and Family Welfare. As more and more evidence is available for COVID-19, the guidelines and recommendations will change over time. The user is advised to follow the latest guidelines and instructions, follow the modifications for the same. So the SARS-CoV infection, which we are all hearing day in and day out, CO is corona, VI is the virus, D is the disease it causes, 19 is because it was picked up in the year 2019. COVID-19 is the infectious disease which is caused by a type of virus which is SARS-CoV-2. So this SARS-CoV infection transmission, this is what has caused a lot of concern and a lot of ideologies which are going behind it. The virus is a respiratory pathogen. It spreads between the people through direct, indirect contact, and indirect is contaminated objects or surfaces, or close contact with infected persons via mouth and by nose secretions. So here you have a picture which shows that this child who is sneezing or coughing, these are the air droplets which go into the air. So this is how we identify that this is a respiratory pathogen. and also by contact with infected via mouth and nose. The same child who is using his hands to clear his nose, it is with these pathogens which get transmitted from the surface and is also in the close contact and infected people via the secretions. So that is the reason why we are repeatedly telling us that trying to propagate that we have to use a mask because this is how it gets transmitted. These are the pathogens with which it gets transmitted. So COVID symptoms that we have, there are certain different categories of symptoms. Some are the very serious ones, some are the not very serious but are common, and the others which could be categorized as less common. The serious COVID symptoms require immediate medical care. If you develop these symptoms, call the nearest health care provider or health facilities and seek medical care immediately. This is not a very exhaustive list that we cannot remember. These are the most common symptoms of the serious illness, but you can get very sick with other symptoms if you have any of this and you need to call health immediately. The ones in the red which we are showing in the pictures are the serious symptoms, that is shortness of breath, difficulty in breathing. Second is the loss of speech and mobility or confusion. And the third is the chest pain. So all these are interrelated. It is the shortness in breath, like we always say that this COVID virus causes happy hypoxia. The patient is not aware and suddenly his saturations are going down, creating shortness of breath. And this shortness of breath leads also to some type of hypoxic mental confusion because of hypoxia, and it might cause some neurological problems. Chest pain is because of the pneumonia and because of the compression caused during the lungs because of the infection and increase in the fluid in the lungs. The most common symptoms these are the serious symptoms which have been depicted in red. The common ones in the yellow are fever, cough, tiredness, and loss of taste or smell. So some of these symptoms could also be common to other flu, which I would be taking up over a period of time. And these are otherwise also because it's a viral illness, so some common factors are there and the symptoms are also quite common. The less common ones are the sore throat, diarrhea, headache, aches and pains, a rash on the skin or discoloration of fingers and toes, red or irritated eyes. So these are the less common ones. However, there is no categorical difference which says that yes, if we see 100 patients, the more common ones which may be having shortness of breath, and there are less which have tiredness, because the less common ones sometimes they go unnoticed. They become asymptomatic carrier. And if you live in the area where malaria or dengue or other infections are common, and you have any of the above symptoms, and immediate medical care is required from your local health authorities. Stay in touch with your primary care providers and ensure you continue to receive the routine care you need, such as medication, follow-up, and routine consultations. Symptoms, because they are non-specific, they could also signify some other illness. So it is extremely important to be in touch with the health personnel and to see that if by chance this could be a very serious outcome or it could be any mild illness which could pass unnoticed. The next question that comes to our mind is, are children at lower risk? There is very limited data available as of now. Children under the age of 18 usually have mild disease. However, cases of critical illness and deaths have been reported. They are not completely immune. So, if I could again repeat that the idea whether children are at lower risk is not we don't have enough evidence to say they are at low risk. In our hospitals, we do see patients who have severe comorbid conditions. Like in adults, you have hypertension, diabetes. In children, we have seen with any neurodegenerative disorders, with acute neural disorders, they come with COVID positive status. It is a cause and effect. Maybe it is their underlying condition which makes them more susceptible to this COVID disorder. Maybe it is their contact with an adult which causes them to get positive status. So exactly we cannot say that they are completely immune. They are very much a part of the system. To begin with, we did not think that children would be so affected, and we thought that it would be, they could tide over the crisis. But over this pandemic period, we have dealt with many serious cases of COVID who require ventilation and have also come out of the ventilatory support. Oxygen therapy is almost 30 to 40% of them who have been declared as COVID positive have come up with that. So our question is, how do children get COVID-19? Most cases in children result from household exposure with adults as the index patient, but transmission can occur from other cases and contacts as well. So it is when the children go out to play, we cannot say that they are immune than the other children, but it is, yes, usually it's a case which is an adult, which is in the household itself. Can children transmit COVID-19 to others? The role of children in transmission to others is not clear. Infected children shed SARS-CoV virus with nasopharyngeal viral loads comparable to or higher than those in adults. The evidence suggests that transmission by young children may occur but is uncommon. Older children and adolescents appear to be able to transmit SARS-CoV-2 effectively as adults. So they could be absolutely playing a role in transmitting the infection. So a question that comes to our mind is, what are the 3 golden rules? How do we prevent the child from getting the COVID infection? The prevention is similar to what we can think of for adults. Always wear a mask, have a face cover, and wash hands frequently and thoroughly with soap and water. Also maintain a distance from others. So the Ministry of Health and Family Welfare has given us this clear-cut guidelines about the 3 golden rules of how we can prevent COVID infection, which is applicable to children as much as it is applicable to adults. The next question that crosses the mind is the use of masks. So adults, we can always tell them, okay, you use masks, wear it correctly. In hospitals, we have a lot of training programs on the correct usage of masks, how to use masks to prevent the infection, how to take care of patients and prevent ourselves, healthcare workers, from getting infections. It is very difficult for a child under 5 years to be told that to wear a mask correctly and how to not wear a mask, because it all depends on the safety. Tomorrow it might become a source of gagging also. So for under 5, it is very difficult to have a very clear-cut guideline that you have to use a mask and in this particular manner. It is usually under care of an adult and where there is minimal assistance required. For children 6 to 11 years of age and who are in good health can wear a non-medical or a fabric mask. Fabric masks are good. They are easier for the child to breathe and for the covering the nose and the mouth. So fabric masks, which could be the first choice from children from 6 to 11 years. Children with underlying health conditions like you have cystic fibrosis, cancer, immunosuppression should be in consultation with their medical providers where to wear a medical mask. So these type of patients we see day to day in our hospitals. One of our wards, which is a hemato-oncology ward, has a lot of patients who are immunosuppressed, who are on chemotherapy, who already have superadded infection. For those children and also for the rest also of the patients, we make it mandatory to wear medical masks, and also their relatives, the patients, the mother and the father who are with the child or any caretaker it is mandatory for them to wear a medical mask because these children are more susceptible and to COVID-19 infection. Above 12 years of age, the wearing of mask is under the same condition as that of adults. So that we don't have any different criteria. Children should not wear masks when playing sports or on other physical activities like running, jumping or playing on the playground. So because this mask child tends to be a little careless, so it's very difficult to tell them that when they are undergoing any physical activity to wear a mask. Face shields, which are commonly used by the healthcare personnel, cannot be used as an alternative to mask, but yes, they do provide, they are some type of a protection is there, but till date we think that the mask is better than, is the best protection that it can provide to an individual. So here is a pictorial description about how we correctly use the mask. So to protect yourself and the other, remember that keep at least 1 meter distance from others. Clean your hands repeatedly and often. Avoid touching face and the front of the mask. Wear the mask with the correct side up and out. So these are the four rules for wearing a mask. Here you can see these pictures, how you have to repeatedly wash your hands. This is the mask. You have to hold it from the margins. You have to hold it from the loops that cover the mask. Here you have, which is a little elevated portion, which covers the nose. And here you see this child who has a mask over the entire face with very little distance over here for the air to come in and go, or rather to have some type of loose area in which the child, there could be a possibility of an air pathogen. Here you can again see this child which has correctly placed the mask, and here the washing of hands, and again repeatedly. When we remove the mask, there is a lot of care which has to be taken. The mask has to be, the hand should touch the edges of the mask and then remove it. They should be looked around that I hope the mask is not dirty, it is not torn, it is not having any wet secretions. Then the hands have to be cleared, repeatedly cleaned. And here you have, which is the wrong way, is when you are touching the mask while removing it. So these are again the WHO guidelines about how to use the fabric masks in children and to use them correctly. So here it is how to wear a non-medical fabric mask safely. Here again the do's, a little bit of repetition of washing hands, holding the mask with the edges, with the loops, wearing it correctly so that the nose and the chin and the mouth are covered. There are no loose areas on the cheek. Wearing it correctly, covering both the nose and the chin. Washing the hands repeatedly, and even using it, seeing it whether it has any dirt in the inside or the out of the thing. These are again the contradictory to the do's are the don'ts. And it is, that is, we have to hold it correctly. It is when you are not using it, when there is no gap over here. And the nose is, this is a very, very common thing that people wear masks a little below their nose. And they wear it with so much of confidence that you sometimes feel like asking them what this purpose is being served. So here it is a very common sight, and how we are trying to see all these pictures in which there are the wrong ways of wearing the mask. So this is all has to be told to you about the use of fabric masks for children and to use it in a correct manner. There is another little box over here which has a very important message for all of you. A fabric mask can protect others from around you. To protect yourself and prevent the spread of COVID-19, remember to keep at least 1 meter distance from others. Clean your hands frequently and avoid touching your face and mask. So this is the role of the mask, that you prevent others from getting infected by you. But if you have to take care of yourself, please maintain a and wash your hands repeatedly, and also avoid touching your face and mask, because it is with these contacts with the hand that reaches the face and then gets infected. A simple thing like hand washing, which has gained a lot of importance during COVID times, not only prevents the spread of COVID infection, but yesterday we were having a meeting in the hospital where we have realized that the hospital infections have got also reduced because constantly the healthcare workers are told, wash your hands before you touch the patient, wash your hands when you enter. Outside the wards we have antiseptic solutions when we enter, before touching every patient and all. So this has become such an inherent part of our system that it has not only helped us for COVID, but even otherwise for reducing infection. So as many times as possible, one has to use and wash it frequently with soap and water. These are the steps with which you have to wash your hands. You take the soap solution, rub it between the palms, rub it through between your fingers, and then again through the interphalangeal space between the thumb and the other finger, rub the palm with the palms, and then with the others with the hands, and then you wash your hands. So this is how we are supposed to do it. So hand washing is also, and it has to be done for a complete 20 seconds. And I'll also tell you a little song which can they say about hand washing, which will come in one of the further slides. This again is how you maintain the social distance. This is how the social distance is maintained. Here, social distance prevents the spread of the virus. And this is all some pictorial pictures which shows how you can maintain this distance of about 1 meter or 2 gaz ki duri, which repeatedly we hear on the telephone and with all the advertisements on. So how do we take precautions at the workplace? Because you see, now we are coming to the point about how these children who are susceptible to COVID, who are sick, and what is the role that we have to take care of the children to prevent the spread of COVID disease, and to get their immunization also according to their schedule. So when coughing and sneezing, cover the mouth and nose with a flexed elbow or tissue. See here this photo of this little child who's taught to cover his nose and his mouth with the tissue. Throw the tissue into a closed bin immediately after use. And clean hands with alcohol-based hand rub or soap and water after coughing and sneezing and when taking care of the sick. So once you have done all these things, when you are having a cough and cold, this is the precaution that you have to take. And planning ahead for social distancing, we are all working, children are studying. So we have to check the information of the authorities and the WHO repeatedly. They are getting updated. Talk to your people who can allow you to work from home. Like you have teachers who are running online classes. Take care of your medical prescriptions and also maintain a social distance. This is a very common question that the child has fever and a running nose. Is he COVID? This is a question that parents invariably want to ask. Does my child have COVID or is it a common flu? So common cold and flu have many overlapping features. So it is not necessary that the child has COVID. The symptom complex is almost similar, but it is not same. So you have the symptoms which are fever, fatigue, cough, sneezing, aches and pains, stuffy nose, sore throat, diarrhea, headache, and shortness of breath. In COVID situation, fever is common, whereas in flu also it is equally common, but sometimes children have seasonal cold. In that, fever is rare. Fatigue is common sometimes in coronavirus, in COVID disease, and in cold, and sometimes in cold, but it is common in flu. Cough is usually dry, it is mild in cold, and it is usually again in flu, it is dry. Sneezing is not common, but it is common in cold. Aches and pains sometimes, and of course common in the cold and flu. So you have running nose and you have sore throat and diarrhea. Corona in children, diarrhea, though it is documented, it is rare, but our personal experience in the hospitals are that children who come with diarrhea are having COVID positive. So it is over a period that our knowledge has also got changed, upgraded with time, with seeing the number of patients. Initially, patients with diarrhea, we did not even get a COVID testing done, but after a couple of cases which we transferred to the ward were having only diarrhea and were COVID positive, and we had to send them back to the isolation. Headache in children is there sometimes, and flu also it is common, but sometimes children are not able to express headache because they are young, and shortness of breath is there sometimes, and both. It all depends on the severity of the COVID disease, whether you have shortness in breath or cough and cold. So a question for parents is, how do we do the talking to about COVID-19? You'll be surprised, but children are very good at receiving ideas and also interpret situations. They are the first to pick up any type of anxieties in the house. So it is very important that you sit, talk to the child. They are very receptive. Tell them in a very simple language what are the problems that we are all going through, the pandemic, the situation, not to increase their anxiety, but to get them aware. Telling them some basics about how to, when the hygiene, about if you are having a cold, if you are having fever, what are the things to be taken care. If a neighborhood child is having some symptoms, you are not supposed to go near them. So it is so important that you have to tell them, and tell them about cleaning hands. Like I showed you the 8 steps in cleaning hands, at least for 20 seconds. So, and it is very difficult to say 20 seconds, yes, but it usually, we also clean our hands. It takes about 8-10 seconds and we are done. So you tell them that you start humming happy birthday to you twice, and it approximately is 20 seconds. Distract them, teach them that the duration of cleaning hands should be at least by 20 seconds, and it should be by as long as the duration of happy birthday to you twice. Set time aside with them, spend time with them, and it could be at least 20 minutes, and keep them well informed about the things happening. If they do, and of course, to praise a child is a very, very well documented way of how we can take care of children, educate them. If they are doing something good, if they come back from play and they are washing their hands, praise them, tell them that it's a very good thing that they have done. If they have done something incorrect, then just don't highlight what is incorrect, but highlight what is correct and tell them the correct manner, whatever they have not been able to pick up. And you won't believe the children will come, but the first people who will come and tell you in neighborhood so-and-so, they are all, staying in the house and they are quarantined and they are ill and they are unwell and things like that. They are level intelligent. They are very intelligent and we should never underestimate them. Gradually, after we understand about COVID, we have seen the precautions to be taken. We have understood how the parents have to take care of their child, and the simple things which are different about COVID from a common flu. So the question is that parents, during lockdown, we had a study which was done, the 3-month period in our hospital, that what was the impact on the immunization services? And the immunization services had come down drastically to almost 1/3. These were the terrible months of April, May, and June, when there was no public transport, when people were afraid to come to the hospitals. Hospitals had kept a lot of social distancing was definitely kept, and there was a general fear psychosis was a lot in those months. Parents were unable to exactly say, do I take my child for a vaccine or not? Immunization, should it be done or not? So immunization against all these vaccine preventable diseases is essential to protect your children. This is the message that I would like to repeatedly say. All routine vaccines should be administered as per schedule as far as possible. Standard infection prevention measures and advisory of health authorities have to be followed, and immunization services in containment and buffer zones are avoided when it is a containment area. But yes, when it is a green zone and the containment has been lifted, then we definitely have all the immunization services which come into play. So this is the immunization schedule which we will be discussing, and this is the common one which would is generally followed. And Dr. Sumit will take over this immunization schedule.
Good afternoon to all of you. So this is the national immunization schedule that Government of India guidelines we are following everywhere in all government facilities. So at birth, there are the vaccine of BCG, oral polio vaccine, the 0 dose, and hepatitis B birth dose is given. Then at 6, 10 and 14 weeks, we give oral polio vaccine, the pentavalent vaccine, the rotavirus vaccine, and inactivated polio vaccine, fractional inactivated dose. It is first dose. And some states have introduced pneumococcal conjugated vaccine as well. So that first dose is also given. At 10 weeks of age, again oral polio vaccine, second dose of pentavalent vaccine and rotavirus vaccine. At 14 weeks of age, third dose of pentavalent oral polio, second dose of fractional polio vaccine, injectable, inactivated polio vaccine, and third dose of rotavirus vaccine. In those states who have introduced pneumococcal conjugated vaccine, the second dose is given. So this pentavalent vaccine is actually protecting against 5 diseases. It contains DPT, Hib, and hepatitis B. So diphtheria, pertussis, tetanus, Haemophilus influenza B, and hepatitis B, these 5 vaccines are mixed together for protection of these 5 diseases. Again, then at 9 to 12 months of age, the first dose of measles and rubella vaccine is given. Pneumococcal conjugate vaccine booster dose is given if it was given previously. And in endemic areas, Japanese encephalitis vaccine first dose is given. It is not in Delhi, so it is not in the schedule of Delhi, but in some states, endemic districts, it has been introduced. This is till 1 year of age. Then between 16 to 24 months, we give second dose of measles rubella vaccine, second dose of Japanese encephalitis vaccine, and DPT booster first dose, along with oral polio vaccine first dose, first booster. Then subsequently at between 5 to 6 years of age, DPT booster second dose. At 10 years of age, TD, tetanus and diphtheria, adult diphtheria. This D is a small d. This is not same as the DPT we have given in the pentavalent vaccine or DPT booster. This is a small d. This is a reduced dose in the older age group. And 16 years of age, again TD second dose. For pregnant mother, there are 2 doses of TD and TD booster in case in second pregnancy, which is within 3 years. So, as already said, immunization service is an essential component of health services that protects susceptible individuals from vaccine preventable diseases. And any disruption of these immunization services, even for a brief period, as happened during the strict lockdown period, may result in increased number of susceptible individuals. So, again, the same principles hold true. Washing your hands very frequently, avoid touch eyes, nose and mouth, coughing or sneezing in your bent elbow, not your hands, and maintaining physical distance are the prime importance to prevent the spread of the disease during COVID pandemic. So what all caregivers should know that there are staggered timings to avoid overcrowding at the immunization areas. Group counseling is being done. Social distancing has to be maintained. Hand hygiene is to be followed. Use of appropriate mask as according to the age. Breastfeeding counseling, nutritional counseling, and personal hygiene to be maintained. Now, very important is that any child who is having some symptoms, flu-like symptoms or influenza-like symptoms, should not attend immunization clinic. Rather than they should consult a doctor immediately for further management of the illness. And also the beneficiary also should not be accompanied by any caregiver who is having these symptoms. So now the next question that comes in mind is that is it safe to vaccinate a suspect child, a child who is having a COVID positive contact or some family member is turned positive in the household? So it is recommended that first the child should complete 14 days of self-isolation to prevent the risk of COVID virus transmission to others. And if this contact does not develop symptoms of COVID-19, then this person can be vaccinated. Now, can a child who is confirmed or suspected infection be vaccinated? So, theoretically speaking, as per available evidence as of now, there is no medical contraindication to vaccinated persons who have COVID-19. But the person who is COVID positive may transmit the disease to others. So it may increase the risk of spreading infection to others who are attending the same immunization clinic. So the vaccination is deferred until the symptoms resolve. And preferably, it was previously said that 2 consecutive tests for COVID negative, but now the guidelines have changed. If the patient is asymptomatic, after symptom resolution, 14 days after the symptom resolution, the child can resume the normal vaccination as per schedule. Now, does the flu vaccine which is being given in the immunization program or it is used in private healthcare setup is protective against COVID, or the child has received pneumococcal vaccine? So, is it required? The other vaccines, which is pneumococcal and Hib and influenza, are for protection of these specific pathogens, which may cause respiratory illnesses, but they do not protect against COVID-19. So, very important question, and which is highlighted day in and day out in media and newspapers these days. Which vaccines are available? So, as of now, no vaccine is being approved for use in our country. But however, many vaccines are in advanced stage of trial, and any one vaccine may receive the approval soon. And as and when these operational guidelines are available, regulatory approval is obtained, then these guidelines will be followed. The priority is the government has identified some priority workers, 30 crore population, which includes healthcare workers, people with comorbidities, elderly people above 50 years of age, frontline workers. These have been identified, which will be immunized given the vaccine in the first phase.
So now the question is that is pregnancy a risk, and how do we say that whether pregnant women should be given vaccine or not? So pregnant women definitely who are older, overweight and have a pre-existing medical condition such as hypertension and diabetes seem to have an increased risk of developing COVID. It is not known if a pregnant woman with COVID can pass a virus to her fetus or baby during pregnancy or delivery. Till date, we have not seen any virus which has been picked up by the samples of fluid around the baby in the womb or the breast milk. Cesarean should be done as and when indicated. The mode of birth should be individualized and based on woman's preferences along with her obstetric indications. So a pregnant woman might also have the question, how can I protect myself against COVID-19? Same things follow for her also. Wash your hands, have adequate space, cough or sneeze using your some tissue paper, and avoid touching your eyes and mouth. In our hospital at Safdarjung, we've had a separate OT for COVID positive pregnant women for delivery. We have not picked up any COVID transmission vertically to the baby. Babies are usually all of them have been identified as COVID negative. Their COVID sampling has been done on day 1 and day 5 of them. Some of them developed COVID because of the environment which could not be avoided. So the question is whether the mother has to breastfeed the child Yes, she can breastfeed the child. She can breastfeed using all the precautions. She has to wear a mask. They have to wash their hands, and they have to keep the child, and after the breastfed child, the child has to be kept at a distance. The mother is given a PPE kit to be worn when she is breastfeeding the child. It is very safe for the mother to breastfeed the child, and it is not necessary that the child will pick up COVID after that. So school time is now, we are all waiting for the schools to open and whether the children will be allowed to go to school or not. So what do we do to protect ourselves from COVID? The same things have to follow: wear a mask, maintain physical distancing, follow the hand hygiene, and back to school. This is how the distance has to be. Now colleges are also opening up, and we are trying to follow all the rules to make sure that the student sanitizes his hand before entering the classroom. And in the classroom, we have made big posters of "do not be seated," so that we have one space empty for the next student to come and sit. And then the children who have been under lockdown for 8-9 months, it has been very difficult to keep them entertained. Screen time has to be scheduled and followed, because since they cannot go out, they spend most of the time either with their mobile phones or with their TV screens. Try to limit them. For 2 to 4-year-olds, try to use about 1 hour of screen time. The older children can be regulated according to their own requirements. It's very difficult because most of the classes are online. The screen use has to be managed by the guardians of the child, and to see that the minimum amount of time is used. Because during this outbreak, there is an average that has been taken out is under the age of 1 year, the child has to be physically active several times a day. Whereas children from under 5 years of age spend about 2 to 3 hours of physical activity, and children and adolescents between 5 to 17 years spend about 1 hour a day, that's about 60 minutes, with vigorous activity, including many activities to strengthen the muscles and bone. At least 3 days per week they should do that. So it is not only to keep them entertained over their mobiles and the TV screens, but to see to it that physical activity is absolutely essential, and in some manner they should be given that. Another problem that the children during COVID have developed is the psychosocial aspects, because of the anxiety that has come up during COVID-19 pandemic. It is loneliness and also anxiety. Many children have poor school performances because it's very difficult for them to pick up the online teaching schedules. They have a delayed physical mental development, poor attention, activity. These are all symptoms of anxiety, hyperactivity, and temper tantrums that they suffer from. They suffer from the recent sleep disturbances also. Mood changes, anxiety, depression is a very common complications that these children have, spending time alone and in a socially isolated environment. So I'm almost coming to an end, that can infections be transmitted by food, fruits or vegetables? There is no evidence that we can say that COVID-19 is from fruits and vegetables. There was a time in the month of March and April that we were all cleaning up our fruits and vegetables. But as such, we have not been able to pick up COVID from this fruits and vegetables, and they both form a healthy part of our diet. So they have to be taken up, and before handling them, to take all precautions, we have to wash our hands with soap and water, and consequently also run the fruits and vegetables with clean water if we have to eat them raw. To take precautions, it's definitely better, because we will not only prevent COVID, but we will be preventing other illnesses which might come from the raw surfaces of the food and fruit. So important, the message is go out only if it is absolutely necessary and stay safe. Thank you very much. I will be more than happy to take questions, Dr. Hemant, if there are any.
Yes, ma'am. Thank you very much for such a wonderful discourse. And there has been a couple of, as we went through and listening to this interesting presentation, the messages were very crisp and clear, that wearing a mask is as essential, and observing social distancing, using common sense, hand washing, and other sanitary and hygienic practices to be continued, like brushing your teeth, etc. However, children do not mimic and they do not fake symptoms. and it is very easy for parents and caregivers involved to pick up if the child is not behaving in a manner that he or she should be. It is decreased if the child, he or she is lousy or behaving different than what he should be. Then once it arouses suspicions in the minds of the caregivers and the family members and guardians that is the child well or sick. It is best to look for temperature, watch out for signs, and observe the child rather than creating panic and rushing to the doctor at the drop of the hat. Because as it is already been observed and disclosed that all illnesses, previous, new and old, continue to coexist, and the new latest feather in the cap is COVID-19, and this is added on to the confusion, and it is luckily not known to be very severe in most of the children. So let's wait and see, observe. If the child is sneezing, coughing, running a fever, don't just panic and rush to the doctor. Let him isolate himself, give him care, tender, loving care to continue. I'm sure all mothers and parents by the age child of 5 and 6 know what needs to be done when the child is sick, and in the next immediate morning hours or OPD, you please take the child appropriately dressed at a time when is least likely to contact others, and if the child is sick, do not go for vaccination until the symptoms have settled. That was some of the messages that ma'am gave. Ma'am, there have been certain. I would like to inform the audience that CGHS conducts vaccination on 2 days, Wednesdays and Fridays, between the hours of 9:30 and 1. And these vaccinations are available to one and all, irrespective of whether you are a beneficiary or not. So CGHS has not stopped giving vaccinations, never did it stop functioning for a single day during the pandemic. However, you make yourself comfortable, observe the child to be gauged for fitness for vaccination on an individual basis, as disclosed by Dr. Sumit and Dr. Ranigera. And the questions that have been asked are very, to a 7-year-old child. So Sumit, I think to throw light on that. 7 years old child, can he be if not previously vaccinated?
Yes, if the previous booster has not been given, he can be given the vaccination schedule, or if all other 1.5 years vaccine has been given, he can be given the booster dose.
And if he has not been vaccinated, as the question is,
If he
has
not been vaccinated at all, then the schedule is certain different. All previous vaccines, the DTP will be given, and other vaccines available. The MR vaccine is to be given. Hepatitis B vaccine has to be given separately.
So, sir, I think that answers your question. Please contact your nearest healthcare provider, because the schedule for an unimmunized or a partially immunized child is different from a regular immunization schedule, and mild variations which have to be customized to the age of the child will have to be made depending upon the circumstances of the child and the caregiver. So, as asked, these presentations are already available in PDF format on the CGHS website. So, because of technical glitches at your end, could not see the slides or the presentation. This presentation is already uploaded. All presentations are uploaded at the CGHS portal or the CGHS website to be used by you at your own convenience at any time. Thank you. If there are any more questions. So the child, you must be watchful for the child to observe their activities. You must be careful. You must continue to give them nutrition, and you must withhold vaccinations till 14 days. Till 14 days of resolution of COVID symptoms, as Dr. Sumit has told. So one must not panic. One must not get upset, because it is better to be late and safe than to get confused and get anxiety all around. And continue to follow healthy practices of social distancing, hand washing, and other hygienic practices. Do not instill unfounded anxiety in the minds of the child. And the child, as Professor Rani Gera said, that children are the first to pick up anxiety at home. So I would request all elders listening to please ensure that in their households the environment is that of positivity rather than anxiety and dread, because the vaccines and bright future is just round the corner. As in the news, many vaccines are about to come. They are bound to make the life safer as expected, and rollout of vaccines is expected nearer than ever before, with priority to senior citizens and people with comorbidities and the healthcare providers and frontliners. So I think with the turn of the calendar, there's hope around the corner, and I hope 2021 will bring good news, better health, and cheer to all. If there are no more questions, I wish you all a Merry Christmas and a very, very Happy New Year, because the next time we meet will be in the next calendar year, same time on Tuesday. So is there any other questions? Feel free to put it in the chat box. And we would like to thank the speakers, Professor Rani Gera and Dr. Sumit, for the wonderful presentation that you've given in the last 1 hour. Thank you very much, ma'am.
Thank you, Hemant. Thank you so much.
Thank you, sir.
Thank you, Dr. Sumit. So stay fit, stay healthy, stay positive in your mind, and see you next time, next year. Merry Christmas and a Happy New Year.